All right, so I'm going to do a topic, and this one may put you guys to sleep. It's a joke about the segment.
Oh, I was like, oh no.
No, I mean, I don't know. It's one that I had somebody ask me about this the other day, and it's not necessarily a plastic surgery topic at all, but it's an interesting topic, and I bet you guys learned something. And I know you guys love learning and being smart and being the smartest person at the table talking about medical stuff, so you guys get ready. So today we are going to talk, I can see Trey smiling here. Today we're going to talk about sleep apnea. You like my AI picture?
Yeah, I was like, another AI.
Dude, I like AI pictures.
That's what I was smiling at.
Oh, you were smiling at that? Oh, okay. I thought you were laughing at me. So we're going to talk about sleep apnea. So what do you guys know about sleep apnea? Putting you on the spot. Sarah, tell me about sleep apnea. Anything.
I know it causes you to snore, and it causes you not to breathe well when you're sleeping.
Mm-hmm.
And just
You
not
guys
to
are
sleep
smart.
well in general.
I forget what's common knowledge these days. When you are a doctor or whatever it is, whatever specialty, and you forget. And I didn't think you guys know anything about sleep apnea. You guys are really smart. So yeah, good. You nailed it. All right, so we're gonna go over this topic because this is one that's interesting because sometimes they call this a silent disorder because most people don't know they have sleep apnea. It's actually diagnosed or discovered by sleep partners.
Yeah.
And my wife tells me I have sleep apnea, and I believe her. I don't know if I think it's really bad, but I don't know that. I mean, how would I know it? I'm asleep. So a little bit of information
You have
about
to do a sleep study.
Yeah, man, you're killing it. You already know what's going to happen. All right, so 40 million Americans have at least some amount of sleep apnea. Now, the interesting part is only about 20% of those people are actually diagnosed. And we just talked about why that is. And the reason is that the symptoms occur when you're sleeping. So it's hard to know that you have it. And also the after effects are things that are very kind of general or chalked up to other issues. So even when people have it bad enough that they have the negative effects of it, they sometimes don't attribute it to sleep apnea.
Right.
And sleep apnea does have some serious health consequences. I mean, you actually can get very, I don't want to say sick, but you can have some very bad events happen if you have severe sleep apnea.
Yeah, it can cause you to, it makes you stop breathing for seconds at a time. Mm-hmm. And it just.
You're on the right track. I'll elaborate on that, but you're right. That is one of the biggest things. So it also affects your quality of life too. And
yeah, because you don't have. Yeah,
because you're tired. So sleep apnea is technically defined as a sleeping disorder with repeated stopping and starting of breathing. That's kind of the hallmark definition of what sleep apnea is. And there is two versions of it.
Okay.
One is way, way more common than the other. The one that's way common is called obstructive sleep apnea, where the muscles of the throat are physically blocking the airway. And I have a picture. Travis, fill up the first one. So this is normal sleep airflow for this person sleeping on their back. And you see the airflow is coming from the nose, it's coming from the mouth, it's joining up in the tracheal area and going down in the trachea to supply air to your lungs. Okay, so that's normal. All right, and this is from the Mayo Clinic. I stole it from their website, but I'm giving them credit, Mayo Clinic. Thank you for this great graphic. All right, show me the next one, Travis. Yeah, so this is what happens in obstructive sleep apnea. The soft tissues of the throat collapse enough that there actually is a blockage of the airway, and you can actually stop breathing entirely. Now, what happens is when you stop breathing, your body starts setting off all these alarms, like your oxygen levels drop, your CO2 levels rise, and it kind of jolts you awake to restore that normal airflow. So you're not going to just suddenly die from sleep apnea. That's not where the risk is associated with that. So that's obstructive sleep apnea. The other is called central sleep apnea. This is much, much more rare, and that is where there is a miscommunication between your brain and your diaphragm, which is the muscle that is telling you to breathe. So instead of it being an obstructive issue, we call that a central issue.
Yeah.
Yeah. That one's pretty rare. I haven't really ever seen anybody with that. So I want to go over some of the signs and symptoms of sleep apnea for those who think that their sleep partner might have it, or if you think you might have it. So the two big ones, loud snoring and breathing cessation in sleep, meaning stopping breathing in sleep. The problem is it's really hard for a person to know that they're doing that. It's hard to know that if you're snoring at night, and it's hard to know if your breathing stopped. So a lot of times the sleep partners are the ones that that make those connections between the loud snoring and the stopping. Other things that the person themselves might know is gasping for air during sleep, like waking up like you're gasping. That could be from the sensation of breathing. Morning headaches. That's one. If you wake up with morning headaches. Dry mouth after sleep is a common one. Insomnia, meaning you can't sleep at night, like you wake up a lot at night because you're waking up because of the stopping of your breathing.
Right.
Hypersomnia during the day, which is like you're really sleepy and you're falling asleep after you feel like you should have gotten a good night's sleep. Decreased concentration because of the chronic lack of sleep. And then irritability and mood swings. Yeah. So you can kind of diagnose that in yourself, even if you live alone, like if you have some of those after effect symptoms, and then if you have some of the risk factors, which we're going to talk about now, you might be able to put 2 and 2 together and think, oh, maybe I have sleep apnea.
Or people are just like, oh, I'm depressed. No, you might have sleep apnea.
It could be. I mean, yes, absolutely that could happen. I'm not saying that everyone that's depressed has sleep apnea.
I know, but a lot of the symptoms are the same symptoms of depression.
Yeah, it is true. Yeah, it could be multifactorial. So the causes and risk factors of sleep apnea. So this is how you would potentially know if you or your partner might have it. Excess weight.
Yeah.
The heavier you get, the more fat tissue there is in the muscles and the airway, the throat.
It definitely makes sense because one of my relatives, they were hitting that point where they needed to do something about their weight, and they started losing weight, and they sleep so much better.
Yeah, totally.
Because they're not snoring and waking themselves up.
Male gender is one. Males are much more likely to have sleep apnea. Increased age. As you get older, you're more likely to have sleep apnea. Structural airway abnormalities. So this is one where you're not going to be able to diagnose that yourself. You can't look at your own airway and say, okay, well, my airway is more prone to have sleep apnea. But a doctor can. So airway abnormalities. Chronic nasal congestion. If people have a lot of obstruction. Drainage. Family history is one.
Okay.
If you have family members that have it, then that would probably be lean more towards structural airway issues.
Okay.
Smoking and especially alcohol at night, because alcohol puts you into that deeper sleep. It relaxes you. You're much more prone to have sleep apnea. Yeah. And then some medical conditions can do it. So if you or a partner, you or your partner think you have sleep apnea, what do? Well, the right thing to do is go see a doctor because they can help you make the right diagnosis. And the way they do that is they will do a sleep assessment, ask you about your sleep history. They'll do a physical exam, and then they will do a
sleep test.
Sleep study. Yeah, you said it.
Oh.
I knew you knew it because you said it earlier.
I was like, what?
What? No, you nailed it. That's exactly right. They do a sleep study. And then if you get diagnosed with sleep apnea, it's like, okay, now what? Well, there are a few things that you can do. One would be to change any lifestyle issues you have that are causing it.
Okay.
So that would be things like, I drink a 6-pack of beer before I go to bed. Well, okay, that's going to definitely weigh into someone having sleep apnea. If you're overweight, like if this is something that's come on as you gain weight, you can lose weight. Smoking's the other one too. And also sleep position. People are much more prone to have sleep apnea when they're on their back.
Right.
If you sleep on your side or your stomach, because of the way the muscles fall in your throat, because when you lay on your back, like your tongue and all that kind of falls back, and it's much more prone to obstruct your airway.
I feel like if somebody has like a lot of drainage, I feel like that could be fixed by allergy medicines, like going to see an allergist. That's a good one too. Yeah, and that's not even one that I thought of, but you're right. If nasal drainage from allergies is contributing, then absolutely right. You fix that, you can definitely make a difference. Because there are people out there that just have mild sleep apnea that if you fix 1 or 2 things, they probably would go away. Yeah. So if those things don't work, then there are oral appliances that people can wear to kind of open up the airway, which personally that would bug me. I don't like stuff on me. I have this weird kind of thing about that. Can you have surgery to fix it?
Yes, you can. That's the last one.
That's what I would do.
Yeah, you're jumping ahead, which is totally fine. You're absolutely right. If you have structural abnormalities of your airway, there are surgeries an ear, nose, and throat doctor can do to open that up. Nice. And improve that. So that is one of them. The one that most people do is CPAP, which I don't know if you guys have ever heard that. It's a continuous positive airway pressure. And I got a picture of someone with CPAP. Trelvis, show us that picture. Yeah. Now, I could never wear that thing because that just looks like a torture
I've seen.
device. But it works very good for people who have really severe sleep apnea. Like
they've come a long way too, because I have a relative of mine that has sleep apnea, and he has to wear like a mask,
like a gas mask.
Yeah, like an actual like gas with the tube and everything. Like
they have gotten a little bit better. I don't know. I don't think I could do it. It's having something on my face while I'm trying to sleep. I think that'd be a non-starter for me.
A non-starter.
Like a freaking like octopus is on my face.
Like the face hugger from Alien. Yeah, hard pass.
Ooh.
I'll just like go sleep by myself.
Yeah.
So,
if I die, then...
So, today talking about sleep apnea. It's a very common problem. About 40 million Americans have it in the United States. It is something that's hard to diagnose yourself because of the fact that the symptoms happen when you're asleep. But a lot of times a sleep partner can tell you're having it if you have loud snoring and cessation in breathing, and you have some of the after effects of that, which would be things like waking up with a headache or not being able to sleep at night or being sleepy during the day or being irritable. Fortunately, there are ways to diagnose this, which your doctor can do, and there are some pretty good treatments that can range from anything from lifestyle modifications to wearing an oral appliance to CPAP or even surgery. So that's kind of the recap on sleep apnea. If you want to learn more, then watch our segment on sleep apnea, and you can be an expert like Sarah and Travis, who know a lot about sleep apnea now because they are educated.
I can diagnose it at this point. So.
Yeah, dude, you can tell your friends, man. Let me tell you if you have sleep apnea.